Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. I'm gonna go over in this video 9 ineffective, very common treatment that's used by healthcare providers. And actually, when you search on YouTube, you will find those treatment all over the place to treat tennis elbow, and I will go over the science why these treatments are not effective. Some of these treatment is actually could cause more symptoms and make it worse. So make sure you watch this video to the end. To understand why these treatments are not effective, we need to understand what is tennis elbow and what's going on internally in the body to know if the treatment is effective. And I'm gonna include the treatment that's not effective in this video based on research studies. So I'm gonna use external paper cut for visualization so you can imagine what's going on internally when you have tennis elbow. So when our body heals after injury from repetitive strain injury that could cause tennis elbow, the body has to go through 3 stages in order to heal. The first stage of healing is inflammation. Second stage of healing is proliferation. Last stage is a maturation. And with the tennis elbow, usually with the repetitive strain injury, you start to have inflammation, micro tear here. So when we have external paper cut, during the inflammation stage, you start to have swelling, redness, the blood start to rush to that area, and you start to experience pain. And sometimes you can see it in your elbow, the lateral part, the outer side part of your elbow swelled up. And when you palpate, you start to feel nod or scarring. And that's very common as part of healing during the proliferation stage. When you have a paper cut, your body has to build a scar tissue in order to heal. If your body does not build a scar tissue, it's open wound susceptible for infection. So scar tissue very essential for our survival. The problem in the tennis elbow condition, when you start to have a lot of scarring here, that could compress on nerve or artery and actually decrease the range of motion of your muscles, and you start to experience pain. We need a scar tissue. We have to have a scar tissue. It's the glue that glue a strained muscle or a sprained ligament or tendon. So, but we do not need too much of scar tissue, and that's what leads us to the last stage of healing, when the body starts clearing up everything from the inflammation stage and the proliferation stage, and clear up the inflammation and the scarring from here. When you have a tennis elbow for several weeks and it's getting worse, it's not getting better, usually you are going back and forth between the inflammation and the proliferation stage, which means you have a lot of swelling there, you have a lot of fibrotic tissue, fascia restrictions. So in order to treat the root cause of the problem, we have to focus on the healing cycle to treat it effectively. So let's go over the ineffective treatment and related it to the normal healing cycle, so to know which treatment that could actually not do anything or actually could cause more harm than benefit. So the first thing that's very ineffective that's used, ice or heat. Ice temporarily decreases inflammation but does not do much to the proliferation stage or does not have a long term on the inflammation. So it's basically wasting time. So the other treatment that use stem or TENS unit, and that's usually cause temporary pain relief but does not to do anything to break the adhesion or decrease the inflammation from the inflammation state. It's very common with the healthcare providers or practitioner, they use a foam roller to rub it over it. But if you have inflammation, they use foam roller or massage to rub over that inflamed area, which actually could cause more inflammation. And when you have more inflammation, that will lead to more scarring, which actually could cause the symptoms to get worse and more complication. The other treatment that's used is acupuncture, which when we look at it, acupuncture and dry needling and combining both, that's 5, and dry needle is 6. When we look at the inflammation, just the needle is not going to do anything to decrease inflammation. It's not going to do anything to break the adhesion that's here. You have to have a mechanical force, and that needle will not going to exert that mechanical force to break adhesion. The other commonly used treatment, joint mobilization, which basically is just moving the joint. It's used by a lot of healthcare providers, but the problem is actually in the soft tissue. It's not in the joint. The problem is in the musculoskeletal system here. So that inflammation, if we have a lot of mobilization, that could cause more inflammation. The other thing that's commonly used is stretching. So the problem with the stretching is that based on the study, stretches cause more inflammation. It could cause more micro tears. So if you have a torn tissue like muscle or ligament or tendon and you keep stretching, you're going to snap it. And actually that could cause more harm than benefit. That's why I personally do not recommend the stretching for my patient, and I have not give any of my patients stretching for the last 9 years because the study showed it's not effective. The other number 9 is strengthening exercises. But the problem with the strengthening exercises, if you are in severe inflammation stage and you start to lift weight and doing the strengthening exercises, you're going to cause more inflammation and make it worse. We need to introduce the strength exercises, but during the right time. You don't want to do it when you have severe inflammation and severe scar tissue, fibrotic tissue. That will make it worse and make it more complicated. So I'm gonna leave a link underneath this video for the 3 most effective, powerful, natural treatment that you can use at home to relieve or get rid of tennis elbow. If you have any comment or question, leave it in the comment section. I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.